Hey, I'm Brian Watts with College Station PT and Performance, and I'm going to be going over some assessment of the shoulder and also some mobility drills for the shoulder and for the wrist. Okay, so the first thing we're going to go over for the shoulder is external rotation, a quick little assessment you can do to see if you're limited on one side versus the other. Darren here is going to reach over his head, reach to the opposite shoulder blade, and go ahead and do it with the other arm. And with this, you want to make sure the neck stays in a neutral position. You don't want to lean forward at all to get back there because that's not showing your true external rotation. Now face the other way. And you can see from side to side how there might be a little bit of a difference here. He went to there, and this one he goes a little bit lower. So his right one's a little bit more limited. The other thing you can do is have him lay down flat on your back. And you want to put your arms, your shoulders and elbows at 90 degrees each. So bring your arms up a little bit. There you go. And you're just going to slowly relax and let your hands go straight back to the floor. And you want both arms to touch the floor if possible. So he's limited a little bit on both sides. Are you totally relaxed? Okay, now I'm going to go over the first external rotation activation drill to improve that external rotation mobility a little bit. So you're going to put your arms straight up above your head. Rest them on the floor. And now turn your thumbs up towards the ceiling, and you keep your head in a neutral position and your forehead off the floor, and you lift both arms up a little bit and just hold that for about 8 to 10 seconds. And you want to go through that about 3 to 4 times. 3 to 4 times, 8 to 10 seconds. And what you're doing here is activating that whole posterior side of the shoulder, especially that lower trap. So here's another shoulder external rotation mobilization drill. You can grab a lacrosse ball, and you can do this on the door frame or on a rig if you have one. And you're going to put it right into your upper chest, just off the front of your shoulder. And I'm just going to go through 3 different movements here. You're going to do 3 to 5 times straight up. And you'll feel some pressure there in the front of the chest. And then 3 times straight out to the side with your thumb up. So working on that external rotation, opening up the shoulder. And then keep your arm up here, 90 degrees shoulder and 90 degrees elbow. Rotate down and then rotating back up. Focus on that end range right there. Hold it for a couple seconds. Up and down. Do that one 3 to 5 times as well. Now we're going to go over some shoulder internal rotation assessment. So I'm going to have Darren here turn face the other way, reach back with his right arm up towards his left shoulder blade. And then you want to do this without trying to wiggle that arm up. Now try it with your left. So right there, so he's going to about there, and you can measure, or you can compare side to side, and do the other one. And he's quite a bit lower there. Okay, so this one, he's a little bit limited on that right shoulder internal rotation. Now go ahead and lay on your back. There's 2 different ways I like to look at it. So you're back in this 90-90 position, and this time you just let your arms go down towards the floor, and as soon as you feel your shoulders start to roll up off the floor, that's when you stop. So most likely you'll feel a little bit of a difference from side to side. Now I'm going to go over a little internal rotation self PNF stretch to do to improve your internal rotation. And so you're going to put your hands underneath towards your tailbone and have your fingers pointing toward each other with your elbows sticking out. And you just want to stay in this position for about 2 minutes and just kind of breathe and let your shoulders relax. And you want to have your shoulders relaxing down into the floor as much as you can. And then after you've been there for about 2 minutes, you're just going to push or drive your elbows down into the ground, so go ahead and push and hold that for 5 seconds. You might have a little bit of pain with this. And then you relax and pull your elbows up off the ground immediately. And you'll hold that for about 5 seconds. And you do this 3 or 4 times, pushing your elbows into the ground 5 seconds, and then pushing your elbows up off the ground 5 seconds. Give that a try. Now we're going to do another internal rotation drill to open up your chest a little bit. So you're going to lay on your stomach, put your arms straight out to the side, and you can do this at different angles, but start with them straight out into a T. And you're just going to bring your opposite foot towards your other hand, and at the same time you want to try to engage these muscles here and pull your shoulder back, and you'll feel that stretching across your chest, and you hold that for about 10 seconds, and then you can switch to the other side. Go ahead and switch. And just make sure you're engaging these muscles right here to pull your shoulder blade over so that you feel that stretch in the front. So you can do 3 or 4 repetitions, 10-second hold on each side. All right, so the next thing we're going to look at is shoulder flexion and abduction. So you can stand up against the wall, and you can put your arms completely in contact with the wall if possible. If you're limited in external rotation at all, you'll probably have a little bit of gap between you and the wall, but that's okay for this drill. And this is really just an assessment to kind of see where you're at. And you can bring both arms, slide them up the wall, and try to keep your forearm and your wrist and hand and your upper arm here as close to the wall as possible as you're coming up. And if you have some restriction in that abduction and flexion, you may feel a little bit down underneath the shoulder or sometimes on top of the shoulder. And then come back down. This is something you can test and retest before doing some of these drills. Now we're going to talk about some things you can work on to improve your shoulder flexion and your shoulder abduction. First thing you want to work on is your triceps. So you can use a door frame or a rig like this and put the back of your elbow up against the rig. Let your head come past the rig a little bit and push until you feel that stretch. And then what you can do is straighten your arm out a little bit here, and that kind of relieves it, and you can go through a little dynamic stretch by just flexing back and forth with your elbow into flexion, and you'll feel a little bit more stretch down through here and up into your triceps. So you can do about 10 reps of those, and then you can go right into a lat stretch. So you grab onto the rig, bring your hand up just a little bit, there you go. And you just want to lean back and squat down, and you want to push your hips out to the same side as that you're holding on with. And you'll feel this stretch down in here, all the way down into your back through your lat. To stretch that lat out, do that on both sides, holding for about 10 seconds, and you can do 2 or 3 reps of that. All right, now I'm going to go over a few things to help your horizontal adduction, stretching out the posterior capsule of your shoulder. The best way to do this is to use a lacrosse ball or something about as hard as it, and you're going to put it up against the wall, pin it on the inside of your scapula, and you're going to pull your arm up and then pull across and hold that for about 10 seconds. And you can kind of roll into it a little bit. So you just want to keep that ball between the edge of your shoulder blade and the wall, and then you can come out of it and do about 4 or 5 reps of that. And then we're going to move it up to a different spot here, turn and face that way. And we're going to work on more your levator scapula. So lean back up against that. You should find a little trigger point that hurts a little bit. Won't be very comfortable. Does that hurt? Find it where it hurts.
There you go.
Okay. And then you're just going to lift your arm straight out to the side, as high as you can, and then back down. We'll do about 10 reps of that. And that'll help loosen up all the posterior capsule of your shoulder and then up into your neck a little bit so that we can reach that flexion and abduction position. All right, now we're going to talk about some wrist mobility. So there's 2 quick things you can do to assess your wrist range of motion. So the first thing is putting your hands straight together, bring your elbows up high, and just push your hands together as you bring those elbows up. And you can kind of see whether or not, if your palm starts coming off the other palm, then you may be a little bit restricted in that one. And then you can flip it over the other way and push down, or push into the back of your hand into each other. And on this one, if you do this for about 30 seconds and your hand starts to go numb, that's actually a sign of possible carpal tunnel syndrome, so you want to kind of watch out for that. But in general, you shouldn't go numb, and you should kind of feel your wrist going straight down. So now if you've found out that you have a little bit of restriction, maybe in the front rack position or in your push-up position, if you're having pain in your wrist, and you've gone through your 2 little assessment things, you can start working on your soft tissue in your forearms on both sides. So you can just take a lacrosse ball here, and you want to mash it straight into that forearm and kind of find where you might be a little bit sore. Even if you're not sore, just kind of roll back and forth, use your other hand to push. And then once you find a sore spot, you can stop there and then just extend the wrist and hold that for about 2 or 3 seconds and then let it back down, and do that about 5 times. And you can spend about 2 or 3 minutes doing this on the inside of your arm, and then you can flip it over if you're having a little trouble with that wrist flexion, or if you have a little bit of pain in the lateral elbow, maybe you have some tennis elbow or lateral epicondylitis. You can put it right on that tendon at the top, as far up as you can. And then once you feel that tender spot, same thing, just flex that wrist and do that 3 or 4 times. And then you can spend, like I said, 2 or 3 minutes on both sides of the arms. All right, so a second, more advanced wrist mobility drill, if you're having trouble getting into that full extension or have pain in the push-up or in the front rack position, you can take a band and hook it up to your rack or a bed post at home. And you want to get out to where you have pretty good tension on the band, where it's almost kind of hard to stay there. And just in your kneeling position, and you just bring your forearm, the elbow towards the fingers. And you want to kind of rock in and out of it first a few times, and then go in and hold it for about 10 seconds to where you can do 2 or 3 reps like that. You want to do this on both sides, and it's a good one to do right before you are doing any kind of front rack position lifts or handstand push-ups or regular push-ups. So give that a try.